Hello, welcome again, Dr. Anthony Gonzalez in Miami Community Health. Welcoming you for another important health topic. This is a topic that's very close to my heart, a topic that I learned about 23 years ago when I had my first son, Michael, not talking. And we're here to talk about speech. What we're doing today with my guest, our friend, Denise Elizondo, who's here, a speech pathologist, who's here to talk to us about speech and the importance of speech and what is a speech therapist. So once again, another important topic. We're going to welcome Denise Elizondo.
Thank you. Thank you so much for having me here today.
All right. So welcome, Denise. Tell us a little bit about yourself. What is a speech pathologist? What do you do?
Yes, absolutely. So I was actually born and raised in Chicago, Illinois, and that's where I completed most of my schooling until 12 years ago, actually. Coming July 4th will be 12 years that I moved to Miami and I haven't left. So I'm still here, and I decided on a career in speech language pathology, which is something that I absolutely love doing and I adore it. And as a speech pathologist, what we do is the best way I put it is we're communication experts. That's what we do, right? So we prevent, we treat, we diagnose different areas of language, speech, language, communication, difficulty, social communication, cognitive communication, dysphagia. So we do a lot.
Wow.
Yes.
And so in your career, I know you're specialized. We're going to talk about kids because her real specialty is in kids.
Right.
But did you start with adults at first? Did you start at the hospital? How does that work?
Yes.
Because I see speech pathologists at the hospital.
Right. So what I did actually is my path was really adults when I first started off. So I worked in nursing homes, I worked in hospitals, I did home health for quite a while. And from that, I slowly began transitioning to working with kids because I felt like my true passion really was with kids. So I transitioned over to kids, and I haven't looked back since.
Right. No, I've already heard you say it twice already. What you love to do and what you're passionate in. And the moment you find something you love to do, you'll never work another day in your life.
Correct. And I think that even us as healthcare professionals, we love helping people, right? That's what we do. And so I just feel so blessed that I'm able to do that every day.
Wow.
Yeah.
Yeah, but you can help people like at the concierge at a hotel as well. So maybe, yeah, that's another helper. That's another helper.
Yes.
So before we get into the disease, being a speech language pathologist is not easy. The career is difficult in the education. Tell us about the education.
Yes, absolutely. So in order to become a speech pathologist, you need to have a master's degree. So you have to have a master's degree. So ultimately, it's about 6 years of school, 4 years for your bachelor's degree, 2 years for your master's degree. And then once we graduate, what we do is we have to pass a national board examination. Once you do that, then you can go on to be a full-on speech pathologist.
Wow. So let's first talk about adults because, that's one of the areas that we see speech pathologists. Right. And so what are some of the common conditions that adults are needing a speech pathologist for?
Sure. So they would need us, or we would be consulted whenever someone has dysphagia. So for example, that dysphagia is ultimately...
Well, what is dysphagia?
Yes.
I know what dysphagia is, but what is dysphagia?
Yes.
Tell our people.
Absolutely. So dysphagia is the difficulty of chewing and swallowing of solids and of liquids. So for example, if someone has had a stroke recently and they maybe have paralysis on one side of their body, now the ability to swallow isn't the same because there could be paralysis in the throat muscles, right? So as a speech pathologist, we would come in and we would assess that patient's ability to swallow safely. We would make recommendations on their diet, for example. Instead of regular solids, maybe they need pureed solids, and that helps them stay safe because what we want to do is prevent aspiration because we know aspiration can lead over time to pneumonia, and that's a dangerous thing.
Right. So to clarify, what we want to make sure is that the food goes down into the esophagus and the stomach and does not go into the lung. And aspiration is when they go into the lungs.
Exactly.
So somebody who has difficulty swallowing is somebody that you will deal with.
See, right.
Okay.
Also aphasia.
Which means?
So aphasia is the difficulty or the inability to communicate verbally and understand language. So, for example, someone who
But you don't need your
suffered
mouth to understand language.
we do. We need our brain to understand the language.
Okay.
Yes. So, in those instances, what we would do is we would work with patients who have had a stroke, typically, and there's been some damage to the language portions of their brain. And so now what happens is when they communicate, maybe they don't understand what their communication partner is saying to them. Or what will also happen is when they go to communicate, what they're saying is actually nonsense words. So it doesn't make sense. So that's when a speech pathologist would come in and help them find a different way to communicate. Maybe it's by pointing to what they want. Maybe it's by using pictures to identify what they want. So that's where our role as a speech pathologist working with adults kind of plays a part.
Wow.
Yeah.
Okay. So we learned about in adults, people who have difficulty with swallowing and so forth. We heard about those that communicate as well. Any other common things that we see in adults that you will need a speech pathologist for?
Right, absolutely. So another thing would be voice disorders. So, for example, patients with Parkinson's disease, which is something that I still to this day work with. We know that Parkinson's is a degenerative disease, right? So what happens, Parkinson's makes you kind of come in. Right? It makes you have slower movements. So with speech therapy, with that, their voice also tends to gets diminished over time. So it's important that they keep using their voice because like the saying goes, if you don't use it, you lose it.
Right.
And that goes the same for our voice. Everything's a muscle. So it's important that we provide them the support, the voice therapy that they need. So we do a lot.
So like if I'm having difficulty swallowing or I'm having difficulty articulating my words, do I go out and find a speech pathologist? What do I do? Like, for the adults that are listening and maybe they have their mom or their grandma or something like that.
Sure. So I would highly recommend that you immediately speak to your primary care physician, talk to them about the problems that you're experiencing. So then that way they can hopefully help you get referred over to a speech pathologist.
Right. And you also have to find the underlying problem as well. And you hope that they've already found out that problem. Okay. So we've touched upon, what a speech pathologist is. We've touched upon an adult care, but let's get now into kids and, children who are obviously closer to both of us as well. And this is a big topic because I hear it all the time. I hear it from my wife, Dorcas, all the time. Like, oh, so-and-so had a kid and now the kid's 2-3 years old, is not talking. And so in kids, where is a speech pathologist involved? Sure.
So typically with children, a speech pathologist is involved very early on because we know that 80% of brain development happens between birth and 3 years old. So that's optimal time for these children to receive the maximum benefit and really benefit from speech pathology or any sort of therapeutic service.
So I'm worried. You mean 3 years old, I'm not developing my brain anymore? Come on, don't tell me that. You're killing me. Right. Okay. But so when should a mom be worried that the kid is not speaking?
Right. So really what I would recommend in those particular cases is if by 2 years old, your child doesn't have a vocabulary of about 50 words or so, I would definitely reach out to
2 years old.
2 years old. Yeah.
Wow.
Yeah. Because again, brain development, 80%. Birth to 3, that's when it's happening. So if by 2 years old, your child isn't really talking that much, using language, then's the time to really talk to your pediatrician about your concern that you're having.
So what happens? The kid is not talking. He's 3 years old. He's got 10 words, 3 words, whatever. What do you guys do? How do you guys make these kids talk? I mean, listen, we have, when my wife complains about the kids that they talk too much, I said, you spent a lot of money and a lot of time in getting them to speak. Now you can't tell them to shut up.
That's right. That's right. And that's usually what most parents say. They say, Denise, my child's not talking. And then, 6 months later, they're like, we can't get them to stop. But, so what you want, I just lost the.
No. So the question is, what do you do? How do you make these kids talk?
Okay. So what we do is the way we get them to talk, believe it or not, is by play. It's actually playing with them. So, and my husband even says to me, Denise, you have the best job in the world. You get to play all day. And it's true. We do it through play, through functional play, right? We can do it through meal times. Meal times, I always tell parents, is the best time to work on communication because it's something that your child wants, right? Maybe they want that extra Cheerio or that Cheeto, right? So that's a great opportunity to teach them the sign for maybe more, right? Or give me. And so there's just so many ways, but we do it through play. We do it through various activities. So there's just so many different opportunities.
I've even seen you guys, of course, I've seen it, a bunch of times. I've seen you guys even having them articulate their lips and move their mouth and kind of imitate those movements and where your tongue goes, because for us it's so easy to communicate, we don't think about it, but for a child who, for example, can't say their R's, and instead of saying red they're saying wed, for example, right? It's teaching them that, well, to make that R sound, our tongue actually has to curl back, right? And they don't. Yeah, I didn't realize that. Okay.
Yeah. And so there's so much going on and so much awareness that has to happen for a child to understand and learn how to produce certain sounds.
So one of the areas you definitely deal with kids are the ones that are not talking. What are the other common areas that you deal with kids?
Right. So one of them, we just talked about it, which is articulation.
Okay.
Right. So we would help them with, if the child is having difficulty with specific speech sounds, we would work with them on that. Another big thing is feeding. We have lots of kiddos. Lately, I've been getting lots of calls of children that are picky eaters. And that is also something we do, since, again, we are experts in swallowing. So that is something that we would do as well, is help those kiddos, teach them, help them maybe not be so aversive, have these aversions to different foods and textures. So we would give them different opportunities to help desensitize maybe that aversion that they might be feeling.
Yeah, but picky eater, it's not like they only like cheese pizza and not pepperoni pizza, right? It's a little bit more than that.
Right. Like these are extreme cases where maybe children aren't obtaining the nutrition that they need, right? And as a result of that, now it's a concern because we need kiddos to gain weight, right? That helps with overall development of their bodies, and if they're not getting the nutrition that they need, that's a big concern.
And also that difficulty with eating, we saw it with Alexander and our kid who had this problem where he couldn't
masticate, maybe.
Yes, he couldn't chew, and we had a lot of difficulty. That's a similar problem.
Absolutely. So with that, we would do lots of exercises to kind of strengthen the tongue muscle, because what happens is when we put food in our mouth, we have to form it into a bolus, basically a ball, right? Needs to form. And then what we do is we slowly start pushing it back to the back of our throat with the help of our tongue. And so if the tongue isn't strong enough, that's going to present a lot of difficulty for kids. And we oftentimes see that they use their fingers, and they're using their fingers to push that food back because their tongue maybe just isn't strong enough to do it on its own.
Any other common conditions you guys deal with kids?
With kids, we work with articulation, with speech and language. So in terms of language, what we do is, especially with school-aged kiddos, these are kiddos that perhaps are having difficulty at school. Maybe reading is causing them some challenges because what they're reading, they're not necessarily comprehending everything. And so when we go to ask them questions about what they've just read, they're not really capturing the whole message. So we would help them take notes, identify keywords that will help them recall specific details.
So it's more than just speech. It's language,
it's
right?
Comprehension. Yeah.
Wow.
So we do that, and we also do social pragmatics. So teenagers, right? Teenagers.
I remember hearing about that.
Yes.
Go ahead, tell us about it.
So teenagers who are maybe transitioning to high school, and now it's how do we make new friends, because the kiddos that I just went to school with maybe aren't going to the same high school that I'm going to. So it's teaching them the rules of conversation and communication, that, the way that perhaps I talk to my best friend isn't the way that I would talk to my teacher. Right. Or my grandparent, perhaps. So we help them work through those different areas of social communication.
Yeah. So important, coming up to somebody else or interacting with somebody you don't know, walking up to a crowd or a group of people, and how to incorporate yourself into a group appropriately, and so forth. So yeah, that's incredible. So you did tell me before we began the show about the CDC and some changes that they made.
Yes.
Explain to us what these changes, just this year, there has been some changes which have not been great changes.
Right. Well, they haven't been great changes as it relates to speech and language development.
Okay.
So two things happened. The first is that February of 2022, this year, like you stated, what happened is that the CDC changed its language milestones for children. So with that, what that means is that previously, children by 2 years old should have 50 words. They should have at least 50 words in their vocabulary. Now they changed it from 24 months to now 30 months is when they should be having those 50 words. So that is concerning to us speech therapists, because I can't overstate how important early intervention is.
Before 3 years old. I remember that. Yeah.
Right. So now it's kind of closing that window on these kiddos, which again is just, it worries us as speech pathologists.
So what's going to happen? Are we going to change the practice, or is there anything going to change because of that?
So we're not sure, because these revisions just occurred recently. We're really not sure, but we're hoping, I hope it doesn't, but at the end of the day, we're just going to kind of have to wait and see.
And anything else happened with the CDC?
Yes. The other thing that happened is that what they did was they stated that by 2 years old, children should be putting 2 words together. Okay. That's a little conflicting, because for us as speech pathologists, our milestones state kind of the opposite. So we know, as communication experts, as language experts, we know that children actually first need to have 50 words in their vocabulary before they can go on to start using 2 words together. So that presents confusion to some parents. Yeah.
Wow. And the last thing we need is confusion.
Right.
Right. And when a parent is, especially when it's your first child and you have no idea and you don't know where to go, what do parents do? What are great resources for the parents?
Yes.
Because I, as a practitioner, I have patients tell me, but doctor, I read on the internet that I should do this or I should do that. And I said, well, maybe you should go see Dr. Google. I don't have his number. Maybe you should go see him. But so what do parents do with these situations?
So I would highly encourage any parent to definitely go to our association, which is the American Speech and Hearing Association website. There they will find milestones, speech and language milestones for children from birth all the way to 5 years old. So that's the number one thing I would do, is have them look at that website, because again, that is coming from us, the experts, right, in communication. The next thing I would do is have them talk to their pediatrician. Let them know. I always say parents know their kids the best. And I'm sure you can attest to that yourself. So I always say, trust your gut feeling. Go speak to your pediatrician or call a therapy clinic. Ask to speak to a speech language pathologist to learn more about the concerns that you're having.
Wow, incredible. Now, let's talk about the topic that nobody wants to talk about, and which is COVID.
Yes.
And how COVID, I learned here how COVID impacted people in other aspects, not only their heart and their lungs, but how it impacted people psychologically as well.
Yeah.
But COVID had an impact as well. And tell us what's happening in the COVID in the last couple of years.
Absolutely. So what I have been noticing is that children, I'm getting phone calls from parents who have 1.5-year-olds, 2-year-olds. And what's happening is they're calling me saying, my child's not talking. Right. And so that's a concern. And we have found, the research is starting to come through now, that pandemic babies born during the pandemic are becoming speech delayed. And it's not that parents weren't talking to their kids. It's that if you think about it, for example, you and I, when we grew up, we had different exposures to multiple settings, multiple people, multiple adults, other children, kids our age. And that's how we learn, right? So now with restaurants closed, malls closed, daycares closed, schools closed, these pandemic babies don't have those same opportunities. I even remember being a child and, going to restaurants and that host waving at us, right? Saying hi to you. And we learned greetings. We learned how to say hi to others. I'm sure you can
Yeah,
relate to that.
no doubt about it. And I think the other important thing is communicating with your parents as a child is much different than communicating with a stranger.
Correct.
You don't barely have to get a word out of your mouth, and your parent knows you and knows what you want.
Right.
You're coming out of your room at a certain hour, or you're asking for something, you're crying or whatever.
Exactly.
But when you're 2-3 years old and you have to ask for something from somebody you don't know, I think the communication, you need more communication.
You need more. Absolutely.
And we're not getting that.
We're not.
So those parents out there that have these kids that are 2 years old, year and a half, that were born March 2020.
Yes.
What do you recommend?
So again, early intervention, right? We know that's what helps, because children from birth to 3, their brain, their mind is just so adaptable and flexible. And let me tell you, these kids will rise to the occasion, right? Given the proper support and tools that they need. So again, I keep, talk to your pediatricians, reach out to a speech pathologist, ask them, trust your gut. If you're worried that your child isn't talking, reach out to a professional that can really guide you in the right direction.
Wow. So let me ask you, food, activity, lack of sleep, any of those things impact the children and their development?
Absolutely. All of those things would. So that's why nutrition, we say, is so important. So these kiddos that are picky eaters or aren't eating, that's a concern for us. That's a big red flag, because we know that nutrition, sleep, all of those things really is what help a child develop.
Wow. Yeah. So we've covered speech and language pathology. Well, not all of it, because I understand it's very complicated. We've learned what they are and how they go to how you go to school and how you get the education. And then we've learned a little bit about adults and some of the diseases and the conditions that adults can have: difficulty swallowing, difficulty communicating, and even understanding as well. And that by 3 years old, 80% of your brain is already developed. I'm worried. I thought I was still having brain development, but I guess not. And then, of course, we talked about the 50 words by 2 years of age, and being an advocate. I think the biggest thing is parents and advocating, right?
Absolutely. So, again, parents know their children best. So if any parent has any doubt or concern, just call us. As a matter of fact, just the other day, I had a parent call me, a friend of mine, and her son is 1.5. And she's like, I'm just worried. I feel like, my older son was saying so much more than he is. And I don't know, that concerns me. So she saw her pediatrician. The pediatrician wrote the referral to come see a speech pathologist, and she brought him in. We did the evaluation. He's actually right where he needs to be. So, but again, the evaluation doesn't hurt. Come in. Let's do an actual formal standardized assessment, and let's see.
The problem was the parent.
The parent was worried. Yeah. She had that gut feeling that something wasn't right. It turns out, he's okay.
How long does one of those evaluations take?
So the evaluation can take anywhere between about an hour to an hour and a half.
Okay.
Yeah.
And it's well worth it to make sure everything's okay.
It is. And what's great is that we do use standardized assessment. So everything that we do is evidence-based.
Wow.
So, we come in, we usually would talk about whatever the concern is, any significant medical history, because that's important for us to know. And then from there, we would select the evaluation and, see what the results show.
Well, I want to thank Denise for coming. Thank you, Denise. Thank you for being here. Thank you for educating us. I, of course, am a biased crowd. I'm a biased consumer, because we've been involved with speech pathologists, speech and language pathologists for a long time in our home. We're still involved with Denise at our home, with Joseph, and sometimes with Alexander as well. And so thank you for educating our community. And of course, best of luck. And if you need a speech pathologist, speech and language pathologist, if you're concerned about the swallowing, if you're concerned about the language, you have kids, seek one out, and Denise Elizondo is there for you.
That's right. Thank you so much for having me.
Well, thank you. And once again, Dr. Anthony Gonzalez here from Miami Community Health. Another important health topic, a topic explaining to you how we can use these professionals that we have in our community to help both adults and children. Remember, early intervention is what's most important. So if you have a concern, seek care, and be an advocate for your family. Once again, Dr.